We're going to go now from Massachusetts to Savannah. Mr. Carter.
Thank you, Mr. Chairman, and thank all of you for being here. We appreciate it. The administration has done an exceptional job, in my opinion, of increasing testing capacity over the past several months. And I know that it is our desire and our goal to get testing to 40 to 50 million tests per month by September. And in order to do that, we greatly need to expand testing. I've said that in order to roll out our economy, we need two things. First of all, we need robust testing. Secondly, we need personal responsibility. That is following the advice of members of the coronavirus task force and making sure we're washing our hands, wearing masks, et cetera, et cetera. Admiral Gerard, earlier you said that 90% of Americans live within 5 miles of a pharmacy or a pharmacist. And I don't mean to correct you, but it's actually 95% of Americans live within 5 miles of a pharmacist, making them the most accessible healthcare professionals out there. I wanted to ask you, and Admiral Gerard, you and I have talked about this many times before. Do you think the administration should utilize the pharmacy personnel and the profession for expanded testing, especially community pharmacists who can help rural and medically underserved communities? I know that we have made it to where pharmacists can provide these tests, but not all pharmacists. And what I'm getting at is if we could get to where the community in the rural and the medically underserved communities, the pharmacists there would be able to do it as well.
So thank you, Congressman. Yeah, thank you, Congressman. And you know how I feel about this. I think pharmacists are one of the most underutilized professions in the country for their training and their expertise and also their trust from the population. And I would just like to put an exclamation point behind everything you have said. In order to work with the independent pharmacist even more than the retail pharmacist, and I'm sorry, I know this is your world, but there's an organization that's sort of an intermediary between that we're working with to make sure that we could bring more and more of the independent pharmacist under contract through our community-based testing program. But I'm all on board, whether it's telehealth, pharmacists, community health workers. We need to get health into the community, and pharmacists are a great way to do that.
Thank you, Admiral. And I've actually I've submitted bill texts that would do just this, that all the pharmacists are on board with, and it's over at HHS right now. And I'd just like to ask all of the members here of the task force if you could help me to get that review completed so we can move forward. I would appreciate it. Also, I wanted to talk, I've been sitting here listening to colleagues on the other side of the aisle who have been saying that the administration and this task force has not done enough to save lives. And as you know, we've talked about the fact that we've had 42% of the COVID deaths have been from 0.6% of the population, that has been nursing home residents. Now, I do not in any way consider myself to have more expertise on communicable diseases than any of the four of you who are sitting here today. However, I will tell you that in my professional career as a pharmacist, I was a consultant pharmacist and I worked in nursing homes. I spent almost 30 years in nursing homes. So I do know nursing homes, and I know that's the last place that you want a positive patient to be at. And I just want to point out that, in fact, I can remember servicing a 100-bed facility years ago that, for whatever reason, did not get the flu vaccine. And we lost almost 20% of our population in that nursing home as a result of a flu outbreak because we didn't get the flu vaccine that year. So I have seen this firsthand, and I've experienced it. And that's what upsets me so much about the decision of some of these governors to put these patients in the nursing home, which would have been the worst place they could have put them in. Now, I say all that to say that, I still believe in humanity. And I don't think any of those governors who made that decision did it intentionally. And I don't think they would have done it if they had known what it would have resulted in. And I say that to point out to all of us and on this committee and to everyone in Congress that I think the administration has done an outstanding job. And I think they've saved lives. Now, have they done everything right? No. No, they haven't. And would they do things differently if they could? Yes. And I believe that these governors would have done things differently if they could. But to point fingers and say that no one cared about saving lives, I think that's despicable. And I don't think that's fair whatsoever. Dr. Redfield, I know that you seem to have had a bullseye on your chest today for whatever reason, but I know that the CDC has done some great things and made some great positive comments. Can you just tell us some of the useful materials that you've released from the CDC?
Well, we've put out the guidance really in a variety of different areas, as you know, and obviously focusing on nursing homes, focusing on obviously individual mitigation steps to limit the spread, focusing on first responders, healthcare settings. I will say something about the nursing homes that I really hope we consider. You know, as we're looking to the fall, I think there needs to be more serious consideration in jurisdictions that have multiple nursing homes to look at whether certain nursing homes are prioritized for COVID patients just because of the situation we went through before. But we continue to put guidance out on them, but going back to school, going to camp, you know, daycare centers, K through 12, wherever the American public seems to have a need for guidance, we either put out a guidance document or we put out what we call a consideration document, which it gives people some better understanding of the impact of COVID and how they can protect themselves safely in those particular environments.
Thank you. Thank you.
Thank you, and thank all of you, and I yield back, Mr. Chair.